Well, I think one of the things that really drew me to surgery was just, even at a young age, I really enjoyed fixing things, liked using my hands, liked to draw, liked to be involved in art class, but at the same time I liked science, I liked knowing how things worked. And so I kind of figured out pretty early that combining those two in surgery was kind of ideal for me. And I was lucky enough to have just some mentors that were able to just kind of point me in that direction. In terms of my backstory, I've lived kind of all over. I've lived overseas in Africa. My dad was a missionary. You know, when we came back to the States, eventually kind of played some football, and so unfortunately had to have some orthopedic procedures and just kind of got introduced a little bit at an early age. So I kind of naturally gravitated towards that, I think. Well, the hand is a special part of the human body in a lot of ways. It's what makes us who we are. We interact with each other and with our environment using our hands. We talk with our hands. We use our hands to perform our work. We use our hands to show affection, and all sorts of things make the hand a special part of the human body. I'd say another reason the hand is special is the variety of structures that you have to understand. So there's a level of intricacy, there's a level of anatomic detail that you have to master. Additionally, you have to master different kind of techniques because whether you're working on a tendon, an artery, a nerve, or a bone, you're going to have different techniques, and so you have to kind of have a wide variety of skills that you have to master, and I found that interesting and challenging. I came to Middle Georgia to join this group, join Ortho Georgia, and a group of talented hand surgeons with a lot of experience. I found that it's great working with a collegial group of folks. And I think there's a very large population. Many times they have to travel for long distances, and therefore you often get to see folks that really need your help. And so I found that taking care of the Middle Georgia community has really allowed me to meet a lot of different folks and really, take care of their hand surgery problems. So the added qualification for hand surgery means that you've taken an extra year after your training, whether it be plastics or orthopedics, to learn some of the finer points of treating the hand. Usually you spend extra time dealing with nerve reconstruction, tendon reconstruction, more complex cases. It's an entire year devoted just to working with experts in hand surgery. What that means is you just have a greater depth of knowledge and therefore can take care of more difficult problems with more confidence. I think one of the many strengths of Ortho Georgia is our hand surgery group. We have 5 surgeons, all with fellowship training, all of which can provide great breadth and depth of treatment. We have a lot of experience, a lot of expertise, and we really do take care of all of the issues that can arise in the hand. I think what's important to find is somebody that will listen to you and who can explain what's wrong and what can be done to fix it, who can give you some options, but really steer you in the way that he thinks is best for you, something that he would do for a friend or family member, somebody who can explain why you need something done, and really make you feel like he's got your best interest at heart.